Quality Assurance and Quality Control lecture. First, why not just send all the lab specimens to the lab? Then I wouldn't need to learn any of this stuff. The advantages of a POCT lab, or point of care testing lab. The reasons why we do testing in the office is a faster turnaround time for results, decreased length of hospital stays, and increased performance of procedures and care on an outpatient basis. Patient-focused care. We give immediate availability of test results, more effective healthcare provider-patient interaction, decreased time of diagnosis and treatment, reduced follow-up visits, and faster patient recovery. A lot of times, point-of-care testing is not usual in our larger facilities, such as Aspirus and Marshfield Clinic. However, some of our smaller clinics or outreach centers may utilize point-of-care testing, mainly due to the fact that lab only picks up their specimens once a day. Some of this testing done right in the office can decrease the time required for a diagnosis and sooner treatment. Technology. There are small handheld instruments such as the glucometer, Hemocue, or Billy screen, which provide mobility, low maintenance, ease of use, most of the time cost effective, and has reliable test results. We sometimes will also use kit methods such as the strep test kits, pregnancy kits, or mono testing kits. And all these technologies and tests are in compliance with CLIA 88. The definition of POCT is point of care testing. Some synonyms are wave testing, alternate site testing, near patient testing, or here in the central Wisconsin area we use the term ancillary testing. Okay, so my physician wants to set up a small lab in his office and he wants me, his MA, to work there and help get it going. What is the first thing I should do? The first thing you want to do is obtain a certificate from the Centers of Medicare and Medicaid Services. And this certificate should either be a waived certificate or a PPM certificate. We chose to obtain a waived certificate, so what must I do to ensure we're meeting all the requirements? So specimen collection and handling is very important. Safety precautions, storage requirements such as reagent or control storage, maintenance on instruments and calibration on instruments, quality control, so the controls are within an acceptable range, procedural steps, interpretation of results or normal values of results, and sources of error. Quality assurance and quality control. What's the difference? Quality assurance is policies and procedures that utilize to assess the overall quality of the lab services. Quality control is a process conducted to ensure the validity and accuracy of the test results. Quality control, the purpose is reliable results, accuracy and precision, instrument functioning properly, reagents reacting properly or appropriately, tests performed correctly, and the person performing the testing performs quality controls. QC, control reagents are samples of tested substances with known result values. Control samples should result in a value within range of the expected values provided by the manufacturer. The reasons to perform QC: was the test performed properly? Do the chemicals or reagents work? We need to check the expiration dates, possible contamination, and improper storage. Does the lab equipment work? When QC is performed, Tests should be performed on all equipment at the start of each day before the patient test is ran. A schedule of QC tests is also run in regular intervals, especially with labs that have a high quantity of testing being done. The summary of quality control, there are different components. There's internal quality control, external quality control, proficiency testing, calibration, verification, and equipment maintenance. Controls performed at a scheduled time, manufactured specimens with known values, various medically significant levels of concentration, and they use 2 levels. There are also internal procedural controls such as the clear background of a pregnancy test. Patient test results can never be reported if the QC result tests are not acceptable. The problem must be resolved and the test must be repeated. Preventative maintenance of laboratory equipment is also an integral part of the QA program. Records must be kept of all quality control activities, such as specimen identification, testing using controls, results of laboratory tests performed, and instrument maintenance and history. Patient identification rules must be followed. So we always need a patient name and date of birth. It is always important to ask the patient, can you tell me your full name and date of birth? You don't want to ask them, is your name Dr. Jones or Mrs. Jones? You want to say, can you state your name and date of birth? Because it is easy for a patient not to be really listening and just say, yep, that's me. Sample identification rules must be followed, so always label your samples right away after collection. Review quality control and record the quality control in the records. Record and report results appropriately and accurately. Examples of some POC tests are the glucometer, and as you can see, we have our glucometer, the test strip here. This is the test strip bottle, which you will want to check the expiration dates, and then you have a positive and a negative control. And usually they have values in which they should be within range. Hemoglobin, here's the device for hemoglobin. A transcutaneous bilirubin measuring system. Urinalysis Dipsticks, which we will do in the next unit. Occult cards and the solution for that. Coagulation instruments. And POC testing is always done at the point of care, meaning right in the office.